You're watching America Trends. I'm Mary Burt-Godwin, and we are speaking with Dr. Schultz. He is the Chief Medical Officer of Neighborhood Healthcare here in San Diego. We were talking about COVID, flu, cold, RSV season that is upon us. Dr. Schultz, thank you for sticking around for another segment. I wanted to ask you, are there ways that we can know which one we have? I believe there's charts out there on the interweb to tell us, which one we have, or does it even really matter? Do you just want to stay home and take care of yourself, regardless of what you have?
Well, it's really hard to tell. The first round with COVID had some distinctive symptoms like loss of taste and smell. And now the more recent strains is acting more like flu or common cold symptoms. It's really difficult to tell. They all share the flu, RSV, and COVID. It's all going to have upper respiratory symptoms, runny nose, cough, nasal congestion, some body aches, some fever, and it's really hard to tell amongst them. The COVID tests are available again, and so that there is a home test for COVID. At your doctor's, you can get a flu test. There are some tests for RSV, but not necessarily rapid tests. So a lot of times we don't find out if we even test for it until we don't find out for a few days on the RSV test.
Yeah, when I was not feeling well, I didn't have a fever or the body aches, and so that's why I thought I think it's just a common cold because I didn't have that part of it, but I did test anyway. So how accurate are those home tests now? It's been a few years that they've been able to perfect them.
The home tests are pretty accurate. The caveat I would say is if your home test has been sitting in your cabinet for a year and a half, it may be expired. Now, they've extended the expiration date on many of the tests, but there's so many different brands of home tests now, it's really hard to keep track of which tests are still good and which aren't. If they're expired, I would try to get some new ones. And they have released the ability to get more home tests again. So
yeah, I think
they should be available.
Yeah, I think maybe just yesterday or someday this week, I went on and I ordered some more, and I did see that message that the expiration date has been extended on some of those home tests, so that's good to know. You mentioned something. Oh, first, actually, before I segue into it, I wanted to ask your, professional opinion about things like, echinacea, zinc, overdosing on vitamins, whatever the things may be. There's emergency and echinacea gummies and all the, or what was it, elderberry. There's all these kind of home remedies, and I think they did wonders for me getting back on my feet quickly. But I'm just wondering, from the medical point of view, I've heard some people say it's a bunch of malarkey. What do you think?
Yeah, I mean, the studies don't really support much improvement for any of those things. I think a lot of people tried them and they feel better. They feel better faster than they would have if they hadn't taken those things. Hard to say. The studies don't really bear that out.
Okay, so no scientific proof. Maybe it's just a placebo effect or something, but I definitely feel better in my mind when I take that shot of immunity that cost me $5 from Whole Foods. They certainly know how to market, that's for sure, because it gets people like me buying their products. So you also mentioned, though, obesity and people that maybe are overweight, not as healthy, that are more susceptible to having serious complications when they get sick. So one thing is, it seems like in America we have an epidemic with obesity. Is that something you're still seeing? Are those numbers going up or down, or where are we at with that?
It's getting worse every year, sad to say. Yeah, the prevalence of obesity is just increasing year over year.
So do you think that has to do with the foods that we eat combined with people not needing to be very active? Because now people can get entertainment right on their phones, on their couch, sitting. Like, I didn't leave my house for 4 days when I was sick, and I didn't, because I didn't have to. And then yesterday I thought, oh my God, I didn't move my body. What are the reasons, contributing factors for that?
Yeah, all of those things. So I think our processed foods are very calorie dense. So a little bit of food has a lot of calories in it. Sweetened beverages are, a can of Coke not, well, soft drinks. I won't call it any particular brand.
Yeah.
They're all the same. If they're not diet, they have 180 calories in a can, 6 teaspoons of sugar, if you want to think of it that way. And we're not that active, and it's so easy to, spend time on your couch, on your phone, or on your device, or playing video games. So, and honestly, for a lot of our patients, our neighborhoods where they live, it's not that safe to go out. So there's all these other societal issues of having a safe place to exercise and having, walkable communities that we just don't have a lot of.
So I wanted to ask you, I've heard a lot about this drug. I don't know if it's a drug. It's something called Ozempic. Is that considered a drug? Prescription medication? Okay,
definitely
so
a drug.
I've heard so much about it. I don't really know what it is. Can you tell us what it is? I've just heard it's not good for you. And I also think if you're taking a pill to make you lose weight, it's not good because you're not going to, the second you go off the pill, you're going to gain the weight back because you're not making adjustments to your daily living. But tell me, from your medical professional opinion, what is it and if it's safe and effective?
It's definitely a drug. Ozempic is a brand name. The generic name is, different people pronounce it differently. It's semaglutide. The way it works is it hits a receptor called a GLP-1 receptor, and it does a couple of things. It makes you feel full even when you're not. It also hits the hypothalamus, a part of the brain, and kind of fools your brain into thinking you're not hungry anymore. It's very effective for weight loss. There's a lot of people using it. Ozempic brand is indicated for treatment of diabetes only. It's not approved by the FDA for obesity. There's another brand of the same generic medication that is approved for obesity, and there's going to be more GLP-1s and GLP-1 GIP agonists that are coming out that will treat both diabetes and obesity. For a diabetic person that's on multiple diabetic medications and looking at or already having complications from diabetes, this is a great drug. It's kind of moved up into being a second drug that we use for type 2 diabetes. Just because it's so effective, and type 2 diabetes is so intertwined with obesity in most cases. So you treat the obesity, you're treating a diabetes, and sometimes we're seeing resolution of diabetes with significant weight loss.
So, yeah, I just have seen so many celebrities talk about it and lose lots of weight, and it just seems unhealthy, though, to me. So I don't know. I guess, would you warn people about it, using it or not using it?
Yeah, to use it just for obesity, it's probably safer and better in the long run to lose weight more slowly and kind of deliberately with lifestyle change rather than depending on a drug. So the drugs are fairly new, and what we don't really know is what happens when you go off the drug, or do you have to stay on it for the rest of your life?
Right, that's the part that's kind of
decades. Yeah.
Right, yeah, that's kind of scary. Well, thank you so much for spending so much time with us today, Dr. Schultz. I appreciate your medical opinions today. I hope everyone does go out and get their COVID and their flu vaccine. I'm going to do it ASAP. Thank you for spending time with us today. And everyone at home, stick around for more America Trends right after this quick break.